At the moment of conception, each human is given 46 chromosomes. These determine your appearance, mannerisms, and physical ability. But the human body is not perfect, and mutations can easily occur. In 1836, near Venice, Italy, a man became ill and suddenly suffered from sleepless nights, loss of motor function, and dementia. Not until 1986 would this be classified as fatal familial insomnia. By this time, it had already passed through generations and was affecting his family. Today, I will discuss the symptoms, causes, and treatment of fatal familial insomnia. First, I will discuss what this disorder is. Fatal familial insomnia is a rare neurological sleep disorder that has 4 stages. The first stage includes insomnia accompanied by panic attacks and strange phobias. This normally lasts approximately 4 months. The second stage involves hallucinations which stem from sleep deprivation. This normally lasts 5 months. The third stage involves complete insomnia, which leads to severe damage to the mental and physical aspects. This normally lasts 3 months. The last stage lasts approximately 6 months, which leads to dementia and total unresponsiveness, this finally resulting in death. Next, I will talk about how this is contracted. This is an autosomal dominant prion disorder. Prion diseases are a family of progressive neurodegenerative disorders, including Creutzfeldt-Jakob disease, mad cow disease, and fatal familial insomnia, according to the Center for Disease Control. Prions are proteins that are folded incorrectly. Once a protein is folded incorrectly, it can ripple through and change all the other proteins in the brain. This is often not caught by your immune system because it does not see it as harmful. FFI is caused when the protein PRNP, located in chromosome 20, is folded incorrectly. Prion disorders eat away at the brain, causing these small black dots, which are holes in the thalamus. The thalamus regulates your sleep and other motory controls. This is also an autosomal dominant disorder, meaning it passes through your genes. When one parent has the disorder, there's a 50% chance that the offspring will as well. 28 families worldwide currently suffer from fatal familial insomnia. The disease does not pop up until childbearing years, so it is often passed down without knowing. Currently, there is no cure for fatal familial insomnia, and treatments are limited. Yoga and other meditation is the only thing that has been known to slow down the disorder. Right now, diagnostic tests have been developed so that when you're an adult, you can be tested just before having children to see if you have the disorder. The next step in science is pre-implantation genetic diagnosis. For pre-implantation genetic diagnosis, embryos are tested to discover if it carries abnormalities. This has first occurred in 1968 on rabbit embryos, and the first human was done in 1980. In vitro fertilization is used. They take a sperm and an egg cell and put them together in a lab, and after it's developed for a few days, they test it to see for any abnormalities. If it is cleared, it is then put back into the woman to go through birth. With pre-implantation genetic diagnosis, there is a possibility of eradicating the disease. Without being passed from family through generations, there is no possible way for it to pop up. But there is another disease that is also common. Sporadic fatal insomnia is the same disease, but it does not pass through generations. It just pops up randomly within patients. For 1 in 33 million, there is almost no hope. Because this disease is passed so easily and is undetected, people feel almost helpless against this. Although this disease is small, it is quite alarming.